Everybody. It's 7 o'clock, so we're going to go ahead and get started. I just want to thank June Jacobs here for coming, or not coming, but taking the time to speak with us today. So today's webinar is Crossing the Great Divide, Navigating the Healthcare System as a Young Adult with Diabetes. As I previously mentioned, the right-hand side has a chat box. That's where you can chat, and that'll just be amongst yourself. The left-hand side is a Q&A pod, and that's where you can go ahead and type questions, and then we'll answer them at the end. And I just want to remind everybody that today's session is being recorded. And this is sponsored by One Touch. So June, you can go ahead and take it away. Thank you.
Okay, thank you. Can everybody hear me okay? Hopefully. I guess you can probably hear me and I can't hear you. So Crossing the Great Divide is really just about what kind of things change when you become a young adult with diabetes or any chronic health issue, and how you can sort of navigate the system because things change once you turn 19. So I don't have any disclosures. So the objectives are keeping healthy in the chaos of change, establishing relationships with adult healthcare providers, a brief look at current technology, navigating healthcare including pump coverage, and this is a BC perspective because that's where I'm from, and sharing the burden of diabetes. So transition is sort of a buzzword at the moment. Most people with type 1 were diagnosed in childhood. There are a few of you who have been diagnosed after the age of 18. Most of you have been followed in a pediatric clinic most of your life, and the pediatric clinic and the parents ensure that you get regular follow-up, and there's a relationship or familiarity with the pediatric team. And then at the age of 17 or 18, depending on which clinic you belong to, you are transferred to adult care. And transition is an issue for everyone because 50% of young people attend their first adult clinic and 35% attend the second adult appointment. There's an increase in psychosocial issues, there's lots of stress, there's anxiety, there's depression, there's lots of changes going on. You might have moved to a new city or province, you don't know how to access health care, and you wait too long and often feeling sick by the time you get any help. And so there's inappropriate use of emergency services and walk-in clinics and no consistent thing happening. So what are the possible reasons for this? So one is that youth and families are not prepared. The adult system is completely different. There's unknowns, there's no relationships established, and you do not want to leave the pediatric team or setting because you know everyone there. There's a transfer communication that's lacking. Often the pediatric clinic might not know where you have ended up, and so there's no transfer of information. And there's a two strikes and you're out situation. And most adult endocrinologists, if you make an appointment and you don't show up and then you don't show up again, you're pretty much having to need another referral before you can get in again. And so patients are being lost to follow-up, and the youth are just not developmentally ready, and medical coverage also changes at this age. So the question is, are they adults or not? So in the early 1900s, youth at 15 were married, they were working, they were having families, and now in 2014, youth at 22 are often living at home, they're on campus, they're mobile, they're unmarried, they're in between careers and school, and affordability-wise, it's not realistic to be able to be out on their own. And the other thing that's happening is their brain is under construction. So teenage brain, the formal operational stage is not fully developed. So that includes logical thinking, deductive reasoning, systematic planning, skills to consider consequences of actions, ability to envisage alternatives to solve problems, and to anticipate and plan actions. So young adults take risks, not because they don't understand the risk, because they do, but they weigh the pros and cons of those risks differently. And studies have shown that brain development catches up to adult functioning closer to 25. So young adults with chronic health conditions are a unique, vulnerable patient population. There's a shift in decision-making from the parent to the patient. There's a transfer from the pediatric to the adult providers, and there's a different culture of care. There's loss of connections. They may relocate for school or jobs. There's incomplete maturity and possible mental health issues. There's change in family doctors. There's student health clinics. There's walk-in clinics, emergency services. And they miss appointments, and then they neglect due process to book those. So from a mental health perspective, this is a chronic life-threatening disease with complex treatment. Some cope and some don't, but coping is demanded. It's not a disease that you can ignore. Some stresses are expected. You have to be alert to depression and burnout. And of course, there's a risk of eating disorders. And when there's added stress, diabetes care is the first to go. And we also have to be mindful of the parents, because the parents have taken full responsibility for their child's diabetes management up to now. They're now relinquishing control of their health, and it's difficult for parents, especially when diabetes is poorly managed. They have to adapt to new relationships with their young adults, and the parents may have changed their life or their career to become their caretaker, and so this is an adjustment, and they don't necessarily want to be excluded at this point. So if we look at the healthcare practitioner and the patient relationship, the healthcare practitioner is the expert on treatment, technological supports, and process. They're the supporter of patient autonomy. They demystify the new technology. They normalize the patient experience, offer a menu of suggestions if necessary, and hopefully are the agent of change. The young adults they're experts on themselves and the ultimate decision maker. They know his or her hopes, dreams, and goals, and they know what has worked and not worked in the past. And they also will choose what they want to do now. And as we know, we can't make anyone do anything. So they have to be ready and willing to do what needs to be done. So reminder to the healthcare professionals is we don't want to give unsolicited advice, direction, or feedback. And we don't want to fix anyone. We need to honor their story. So if you just dictate what's going to happen, they are not going to be listening. And it's not just a numbers game, so we need to try not to obsess too much about numbers, and the A1C is just another number. It's not a perfect system, and you really want to watch your body language and emotions when seeing a high or low number or no numbers at all, and that the number itself is no one's fault and every problem has a solution. And then food choices. We want to remember that sugar is not the bad guy. We want to try to match insulin to food. Difficult foods require problem solving, not banishment, and we want to treat food as an experiment. And treats are treats. And carb counting, we want to ask questions to test knowledge, don't make assumptions. And student budgets and timetables make it difficult for food choices as well, because they're juggling work and school often. So it's about relationship building. One visit is not enough to establish relationship, and I find lots of kids will go to see someone for the first time and decide that they judged them or they didn't like them, and then they don't go back. And I think it's important to realize that it does take more than one visit to make a relationship. So they should make another appointment before leaving the clinic, rather than just say, call us if you need to come back. And it's okay to admit that you are struggling, and it's good to share the burden. So bringing a support person of your choosing, if it's no longer your parent, whether it be a friend or a boyfriend or girlfriend, whatever works for you. So supporting autonomy as a healthcare professional, we want to give them as much choice as possible. We want to empower them, the right and the ability to make good choices for oneself and the full responsibility for the outcome. And you want to accept unconditionally and believe in their ability and the right of the other to make decisions for themselves. And as a young adult, you want to build respect for yourself. You want to return the phone call. You want to confirm attendance to the clinic. If you can't make it, you want to let them know and you want to reschedule that appointment. You need to allow your diabetes to come first at least every 3 months so that you are attending to it at least that often. And health is important if the world is to become your oyster, so don't let diabetes limit your life. And technology is changing, so be the agent of change. As a healthcare professional, you should be knowledgeable of all of the choices available for diabetes care. And as a young adult with diabetes, you should seek to know your options. Just because you've been doing what you're doing for a while and it seems to be working, it doesn't mean there isn't a better way. And you should be open to change because technology is changing all the time and hopefully in your favor. So you can use your mobile phone. Your mobile phone, you could use your Notes app to list your doses of insulin, your blood sugars, or questions for your diabetes team. You can use your contacts for the clinic, the pharmacy, the adult endocrinologist. Use your calendar app to remind you of your appointments. There's many carb apps, exercise apps, diabetes logbooks, etc. that you could use to keep track of things with your diabetes. And it would be nice if healthcare started using some different communication modes that were more in keeping with young adults, so texting appointment reminders, using YouTube videos for teaching purposes, iPads in the office for surveys or communication, Facebook or Twitter for communicating technology changes. That seems to be something that's slow to happen, but I'm hoping that it will start to turn that way. So what options are out there technology-wise? So there are now meters that you can plug into your iPhone and test your blood sugar that way, and your logbook is kept on your phone. There are meters that figure out if you put in your carbs and your blood sugar, how much insulin you should take. There are pens that don't look like pens. There are all different colors and smaller, so there's lots of options out there for choosing something that works for you. And insulin pumps are another choice for insulin delivery. There's more flexibility, they're comfortable, they're small, there's less injections. They're very technological, they're more portable, and they're now covered in BC until your 26th birthday. But of course, they still require work. This is a quote from a symposium a while ago that said, initiation of insulin pump therapy is an exhilarating, although anxiety-provoking experience for diabetic patients. It is, in a metaphysical sense, a time of rebirth. Patients are no longer victims of their diabetes, but truly masters of it. No statement better illustrates how basic this change is than that of a patient who says, what a difference it has made in my life to eat a meal because I want to, not because I have to. Another option out there is continuous glucose monitoring. So the pros of that, you now get a video of your blood sugar versus just a snapshot. At a quick glance, you know if you're trending up or down without stopping what you're doing. They're smaller now, they're less invasive. They can stay in for up to 2 weeks, and you can figure out problems with your rates by reviewing the trends. Of course, the cons are it's a bit of information overload sometimes. The more info you see, the more action you have to do to fix things. And it's another device that you have to attach to your body, and it's also expensive and it's not covered in BC. So sensors run about $65 to $80 each, and you are changing those every 2 weeks. But when you look at just checking your blood sugar versus continuous glucose monitoring, you will see that you would be missing highs and lows that you didn't know were there by just doing random checks. So what are the choices in BC for pumps? Right now we've got the Omnipod, which is a tubeless pump. It's like a patch pump. You put it on anywhere that you would put a site, and then you remotely instruct it what to do. It runs its base insulin without being near the actual PDM, but you need to have the PDM near it to be able to give yourself a bolus. The Medtronic Veo allows you just to use it as an insulin pump, or if you want to also use it for continuous glucose monitoring, it has a sensor capability as well. So you can use it for both. The Animas Vibe, also you can use with CGM, or the Ping allows you to remotely give yourself a bolus from your glucose meter or directly from your pump. And then the Dexcom G4 is just a sensor that you can wear. So if you are not on a pump and you want to see what your blood sugars are doing continuously, you can use the Dexcom G4. I think whatever pump you're choosing, you should take a look at all of your options, because you are making a 5-year decision, and it's a $7,000 investment. So you do want to make sure it's the right one for you, and they all have little features that are a little bit different from each other. So who is eligible for coverage in BC? You have to be 25 years of age or younger. You have to have type 1 diabetes or another form of diabetes requiring insulin. And you are covered under Fair Pharmacare, Pharmacare Plan C, or Pharmacare Plan F. You have confirmation from your diabetes physician that you meet the medical criteria, which requires a form to be filled in, and you have special authority coverage. So the special authority coverage comes from the physician filling in the form. So the special authority criteria are, for your initial pump, if you've never had a pump before, you're 25 years of age or younger, you're diagnosed with type 1 diabetes or another form of diabetes requiring insulin, and you're checking your blood sugar at least 4 times a day and recording the results, and your family agrees to age-appropriate ongoing diabetes education. Plus, you have to have had frequent hypoglycemic episodes or frequent diabetic ketoacidosis episodes or unpredictable swings in blood glucose. And I would say most people with type 1 diabetes have unpredictable swings in their blood glucose. So for subsequent pump renewals, the criteria is slightly different in that you do have to still be under the age of 25, or under the age of 26 rather, diagnosed with type 1 diabetes or another form of diabetes requiring insulin. The patient and or family agrees to age-appropriate ongoing diabetes education, and the A1C is less than or equal to 9% on 2 occasions, one within a month prior to the application, another at least 4 to 6 months prior. So, and the patient has had no more than 1 diabetic ketoacidosis episode in the past year. And the reason for that is you just have to prove that the pump is working for you in keeping your diabetes within a good range. So Pharmacare covers 100% of the cost of one of the approved insulin pumps every 5 years, subject to the rules of your Pharmacare plan. So if you are on Plan C, it covers 100%. If you're on Plan F, it covers 100%. But if you are covered under the Fair Pharmacare plan, it covers 70% of the cost above your deductible and 100% of the cost above your family maximum. So you need to be sure to register for Fair Pharmacare before you purchase a pump to ensure you get maximum coverage. Now, after 18, a child is off of the family's Fair Pharmacare unless they are attending school or university full-time up to the age of 24. If that's the case, by the December of the year that you turn 19, you need to have filled out a form on your, if you want to keep them on the parent's fair pharmacare. If you do not fill out the form, you will get a bill. If you're not going to school after 18, you are registered for fair pharmacare coverage for prescription costs and designated medical supplies. You only remain on your family's fair pharmacare until December 31st of the year you're no longer covered. At that time, you need to contact Health Insurance BC to establish your own coverage, and you do not need to register for fair pharmacare. You need only to request separate fair pharmacare coverage. So you fill in your new medical form. You still stay with your same medical number. However, now you're on your own fair pharmacare, and usually most people at the age of 19 are not making enough money that they're required to pay anything. So usually your deductible is very small the first year that you're covered by fair pharmacare on BC Medical. So it's income-based. If you're making less than $15,000 a year, you would be 100% covered. But you must fill out the form. So which pumps? So the pumps that I showed you, Animas Canada, GlaxoSmithKline, which is the Omnipod, and Medtronic of Canada are the three companies that are covered in BC. And all of their supplies are also covered. So you can order your supplies directly from the company, or you can get them through your pharmacy, and they will be covered. So this is the website that's the patient handout for coverage for pumps. And there's one special authority form for all ages, and whether it's a new start or renewal. And that does need to be signed by the doctor. So young adults going to clinics that are on pumps, it's important that that adult clinics are up on pumps. So you need to ask the questions: how often are you testing your blood glucose? Do you download at home? You want to look at the reports together, because if you never look at the reports, you'll just continue making the same mistakes. And it's just like really with your blood sugars, if you don't ever write them down, you won't really ever learn where you need to make adjustments. Sites, you want to look at where do you inject, can I look at your sites, how often do you change your site, what infusion set are you using, do you prime your infusion set, what type of insulin are you presently infusing. Basal, can you show me your set basal rates? How do you determine your basal rate is set properly? Do you use the temporary basal feature? Bolus, do you bolus for all meals and snacks? Are you using the bolus calculator function? Have you tried the dual combo bolus? What insulin to carb ratio do you use, and does it change throughout the day? How do you determine if your bolus is sufficient? And then hypoglycemia, how do you treat hypoglycemia? Do you always have supplies with you? Do you ever suspend your pump for hypoglycemia or use a temporary basal rate? Are they happening at a certain time of day? Do you always feel them? And hyperglycemia, at what glucose level do you give a correction? If your blood sugar does not respond to your correction, what do you do? Do you always carry a pen with you? Do you have extra supplies with you? Those are all important questions. So it's a collaborative partnership, a pas de deux. And you need to embrace diabetes as a part of you. I think that it can be mentioned to sell yourself in a job interview. It shows responsibility, multitasking capabilities. It shows your focus on health. You need to let others know that you have diabetes. Don't be ashamed or embarrassed. People are interested and respectful, and you may need someone's help one day. So you want to share the burden and teach others about diabetes because most people are interested. And you want to get involved. So if you'd like to see pumps for adults covered in BC or the province in which you live, you have a voice. CDA is a good avenue to get involved, as well as JDRF. There are lots of groups with young adults. There's I Challenge Diabetes, Connected in Motion. There's Mike Lawson, who does blogs and YouTube videos. There's a group called Young and Type 1 in Vancouver. And these are all ways you can get connect with others struggling with the everyday challenges of type 1 so that you don't have to feel alone. And so you don't have to struggle with diabetes alone. You want to build relationships with adult diabetes teams. Therapies are constantly changing. Technology is making life easier. And you want to stay healthy, as well-managed diabetes is really the cause of nothing. So rather than hearing all these horror stories about what's going to happen if you don't, I think you need to remember that if you stay healthy, that you're not going to get those complications. So thank you, all of you, for listening, and I'm open to any questions. Angela, am I supposed to just answer the question?
Sorry, my phone is disconnected there. So I have a question, thank you so much, from Carrie. It's
Yeah.
What is your personal opinion on good BG ranges?
My personal opinion is on good blood glucose ranges, I think it would really vary. But I would say you would want to be between 4 and 8. Realistically, probably between 4 and 12 is where you're going to end up. But I would be aiming for between 4 and 8 as long as I wasn't having too many lows.
Okay, perfect. Just a question about the slides. The slides are available here. Oh, sorry, not here. Just give me a moment here. I have an email. If you want to email at infobc@diabetes.ca, and then you can request a copy of the slides. As well, we are recording the webinar, so once the site's up and going, then you'll be able to get a link. Sorry, am I still muted here?
Michelle?
Oh, no. Okay, sorry.
Oh.
I saw
you were saying
that.
that.
So sorry, as I was saying, the webinar is going to be up, so then once they get that up and going, you'll be able to look at all the recordings as well. But you can email info@diabetes. Another question here regarding getting a second pump covered after the 5 years. Do you know if you have to return your old pump when you get a new one, or do you get to keep the old one?
You absolutely get to keep your old one. It's yours. You bought it. It's yours, and you keep it as a backup.
Perfect. Can you please repeat the part about pharmacare after 18? If the child is living at home, do they still have to fill out a form?
Yes. So yes, this is the one thing in BC that's always a problem for most people. So when they turn up until their 19th birthday, they are covered under your pharmacare. When they turn 19, they need to get their own pharmacare. If they're not going to school, they need to fill in a form that says they need to have their own fair pharmacare. If they are going to school, you still need to fill in a form saying they want to remain under the parents only if they're going to school. So if they meet the criteria, they stay on that one, which means they stay on your fair pharmacare. So realistically, it's better for them to have their own fair pharmacare because it means they don't have any deductible. So if they're not going to school, they're better off just having their own, and they don't have to pay for the medical because they don't make enough money. Does that make sense?
Yeah, it does to me. Another question here. What does someone with type 1 do if they decide to leave the province or country?
Ideally, they would have their endocrinologist in the province which they live to try to get a hold of another one for them to key up with. If that's not the case, most diabetes clinics, you can self-refer, so you can find a clinic in the country or province where you end up and self-refer yourself to that clinic, and once you get a doctor, whatever, see an endocrinologist there.
Okay, perfect. Okay, so it looks like that's the end of the questions. If anybody has any more questions, feel free to just type them in the QA pod. I'll just look out for them before we leave here. So just thank you everybody who attended the webinar tonight and all the volunteers who coordinated this session. And again, thank you, June, of course, for speaking with us today. I want to just remind everybody that you'll be sent an evaluation survey tomorrow and encourage you to complete it. It will only take about 2 minutes and provide some really valuable input. The webinar is generally supported again by One Touch. And just some information on the charter is an initiation, and you can go to mydiabetescharter.ca to read more about that. Oh, and I have another question here. I've recently moved to a new city in BC, so I have no doctor right now. Is there a place I can look to see available doctors who are knowledgeable with type 1?
I would ask at the diabetes center. So there is diabetes centers in most areas, but endocrinologists wouldn't be listed under available doctors, and in BC we have a real problem with getting a family physician. There aren't a lot available, and so I think to prevent ending up sort of going from walk-in clinic to walk-in clinic, I would try to either get your doctor who saw you in wherever you were and see if they can refer you to someone else, because they would have a list of endocrinologists that they could refer you to, and that would be your best option, I would say, rather than just trying to find someone. But diabetes clinics are a good place to go because you can self-refer there, and you can they'll know who's available.
Okay, great. And just have one more question. I just have to expand something here to see the complete question. Just a follow-up, I would assume that the coverage changes if you change province countries, but what does that mean for one's finances? Is a person with type 1 stuck to their current city for life if they want to live affordably, especially if they're still a student or unemployed?
I think that's most medical coverage, you can get coverage in another province for up to a year, I believe. And then once you're a resident of another province, you can then get their coverage. So if you end up staying, like if you're in transit, you can keep the coverage in the province that you're in. But if you move to another province, you can become a resident, and I believe you have to be 3 months living there before you become a resident, and then you can get their coverage. So you're not stuck living wherever you're living, but then you would be subject to whatever coverage is in that particular province if you wanted coverage for pumps or whatever. I don't think that. No, you're definitely not stuck, and certainly if you move to another country, you would, once you had a resident status, you would be covered in that particular country.
Okay. Question from Linda here. Do you think it would be a problem to switch to a different kind of pump, or would it be better to stay with the same kind?
I think that it's always good to look at what the options are. I would definitely, I think that people take the easier route and just doing the one that they've always done. However, I think that all of the pumps are coming up, all of the pump companies are coming up with something new all the time. So I think it's when it's time to renew your pump that you're now making a 5-year decision, and you need to know what's the latest and greatest, and is there something that works a bit better. It really is only going to take you a few weeks to kind of learn the new pump and what its little differences are. So I think it's definitely worth looking at what all your options are. It's just like buying a car, really. You don't want to just keep driving a Volkswagen because that's always what you've done.
Mhm. Okay. Perfect. So that looks like all of the questions. Again, oh wait, hold on. I see something in the chat box here. Do you have any recommendations for a parent of a 24-year-old who is not controlling their diabetes?
That's always really difficult because it happens a lot where the parents relinquish control and then the kids don't necessarily do a really good job of taking care of their diabetes. I think that I would still, just let them know that you are interested and that you care without kind of getting into what are the numbers and all of that. I think just always being there as a support and being open. It's a hard thing to watch, but I don't know that you can really just parachute in and fix it, unfortunately. But just creating support systems maybe within his friend group or whatever, I think the not to give up, that they they will eventually change their mind, and hopefully can just keep them safe until then.
Definitely. Thank you. Another question here. If there is a problem with the pump, where can I find help or replacement?
From the pump company. So most of the pump companies have a 1-800 number that's usually available 24/7. And so if there's a problem with the pump, they should troubleshoot that for you and replace it. Usually within 24 hours, they'll replace it.
Oh, okay.
It's always a good idea to write down what all of your rates are, like I said, using your notes app, so that if your pump breaks down and you have to get a new one, you actually know what the rates are and you can put them in rather than starting from ground zero again.
Great. So it looks like those are all the questions. Oh no, one more. You never know, because we got time. How does BC's coverage of insulin pumps compare to other provinces in Canada?
I think it's better than some and worse than others. I'm not totally versed in all of them, but I know in Ontario, I believe it's covered for children and adults, and also in Alberta now. Prior to that, I don't think Alberta covered anybody, and now they cover both, so they're actually ahead of us. I'm not sure why they chose to only just cover up to the age of 26, just because I think that's that in-transit kind of population that doesn't really have any money. But I do think that it's not reasonable that they're not covering it for adults, because once you're using a pump, you don't really want to have to switch when you turn 26 to something different. But I don't think that there's cover. I'm not sure about some of the other provinces, but there are provinces, I especially think back east in Nova Scotia, and that they don't have coverage for pumps. So.
Okay. You mentioned, another question here, you mentioned eating disorders are sometimes common with type 1. What are ways to help prevent someone with diabetes from developing eating disorders?
Well, that's a tough one. The problem with diabetes is there's a lot of obsession about food, and as you're growing up, there's lots of discussion about food and what you can and can't have, etc. So I think minimizing that, now that we've got ways to handle whatever it is food that we want, and we certainly now with kids are just using, normal diet, whatever, you just try to figure out the insulin to match the whatever you're eating. I think, though, it's really important to be alert to your own body and to know when you feel like you might be getting into trouble and to ask for help. because it is a common thing that we see, and the sooner that you can get it treated, the better, because it can start to control you, and it's a difficult thing to deal with. So I think preventing it with a child with diabetes or even a teenager is to just, not obsess. And the other thing we do all the time at clinics is we weigh people, which is a terrible thing as well. So we're always watching people's weight, which is also a bad thing to do. So I think everybody trying to taking the focus off food and weight is a good idea.
Okay. Just a follow-up. Would you have any idea when BC will follow up with other provinces and cover insulin pumps for adults? Type 1 does not disappear when you turn 26.
I totally agree. So I think that the young people need to rally the government and say there is a demand for it and a need for it, because until they hear from you, they don't know what the need is. So I feel like it has to come from the people that need it, and you have the biggest voice.
Yeah.
So it's about somebody rallying, and I think certainly the CDA could help that by bringing that forward. Sorry.
No problem. No, that's a really great suggestion there. Okay, I'm just going to do a scan, and it looks like this is it for questions. Oh, no. What would be an appropriate... Oh,
okay, sorry.
No, it's okay. What would be an appropriate way to try to get coverage for CGMs?
I think the same way.
Yeah.
I think that we really have to prove that they're helpful. But yeah, I think it's the same way. People writing letters to the government saying it makes a difference. I think that's really the only way to get them to listen.
Great. And then Sharon actually just put a note in the chat that if you're interested in any sort of advocacy, to please email us at infobc@diabetes.ca. So along the same lines for things like coverage.
Yes, agreed. I think that that's something that we should be rallying for, because I think that I know I was in a conference recently, and in Ireland there's coverage there for sensors. So there is sensor coverage in other countries.
Okay.
And it is a valuable thing, even if you only use a sensor for a couple of weeks to kind of get an idea of what you need to change. It's really helpful.
Yeah. And I got another email address actually sent to me, so it's on the chat as well, bcadvocacy@diabetes.ca. So 2 different emails you can use there.
Okay, great.
So it looks like that's it. Thanks again so much for speaking with us and everybody who joined us tonight. I know it's a little bit late for some people. The development and delivery of programs such as this webinar series is made possible through generous support of our donors. If you enjoyed the webinar and you'd like to make a donation, you can definitely go to our website, www.diabetes.ca, or you can call 1-800-BANTING. So thank you everybody again, and we'll see you on the next one. And take care.
Okay, thank you.
Thank you so much.